All right, welcome everyone to another Coach Nate show on this Friday, December 29th, 2023, moving closer and closer to 2024. Thank you so much for joining me. I'm looking forward to this discussion on nutrient deficiencies associated with inflammatory bowel disease. So we have a lot of things to cover. I have a lot of studies that I want to pull up, go over, have on screen so you guys can see which ones I'm referring to, which ones I'm talking about, but I'm going to make it super simple for you all and just break it down myself. We're not going to read through the studies. Maybe I might point out one or two things from the studies, but I'm not going to read through the studies today. I'm just going to go over point form what the studies are saying. Now, a lot of you are joining us. Thank you so much for joining me this morning. If you can, let me know where you're listening from in the comment section below. If you have any questions, feel free to ask those questions as well. But Happy New Year coming up. Merry Christmas, and hopefully I'll get on here before the new year, which is only a couple days away, surprisingly. But today's big one, inflammatory bowel disease. What are some nutrient deficiencies that are going to be associated with inflammatory bowel disease? And the reason why I want to discuss this today is in the United States alone, if we're not talking about worldwide, just 10x the numbers, maybe even more, all right, because the nutrients that we see in other parts of the world are unfortunately lower than we are getting in the United States. So 10x, I would text at 10x the numbers. But we see in the United States alone, as of, I believe, 2022, we have millions of individuals who are diagnosed, and that's the important number, who are actually diagnosed with inflammatory bowel disease, which can include Crohn's disease, which can include different types of colitis. And, sometimes I think diagnosed is the important word, because I've had family members where it took nearly a decade. I've had clients where it took years for them to be diagnosed with things like Crohn's disease. They thought it was just irritable bowel syndrome or, just chronic diarrhea, things of that nature, where they actually did not diagnose them with inflammatory bowel disease or Crohn's disease. Like I said, Crohn's disease, they're going to be interchangeable in today's discussion. But it took years, if not a decade, for them to be diagnosed with this disease. So I wanted to make sure I got on here something that's going to affect millions and millions of individuals, and you might not have been diagnosed. If you are dealing with any of the symptoms that I'm going to go over today, then I would speak with your medical practitioner, okay? That's the most important thing. Speak with your medical practitioner. Try to get some tests done if you can. Push, and then really focus on your own health, because you are your biggest advocate when it comes to your health. Now, just real quickly, my face is not on cam, even though I'm going to bring the studies up. I don't have my face on cam. That's going to be coming into the new year. We already did a couple streams where my face was on cam and the new studio was shown, and you guys were able to see that. So don't worry. That will be happening as well. But again, I want to thank you all for joining me for today's edition of the Coach Nate Show. We have no one in chat. Let me know if you can hear me. I love seeing the engagement in chat. I know you guys came hot out the gate. We had a lot of people who were viewing. We still have a lot of people who are viewing. So let me know if you can hear me. We're going to continue with our discussion and get right into it. So, inflammatory bowel disease. Before I pull up the studies, let's get right into what some of the symptoms are. All right. A lot of the times when it comes to inflammatory bowel disease, maybe Crohn's disease and things of that nature, colitis, all right, we see symptoms of diarrhea, all right, bleeding, abdominal pain, all right, rectal pain, and then weight loss sometimes. Fatigue is a big one. So if you're feeling fatigued, I think that's one of the biggest ones here, and fever, all right. Risk factors can be age. There's a number of risk factors, all right. But if you're dealing with some of those symptoms, I would be making sure that you're speaking with your medical practitioner. For Crohn's disease and anything of that nature, when it comes to inflammatory bowel disease, all right, remember, Crohn's disease can involve any part of the small intestine or large intestine, all right? So be careful of that. You might be feeling pain in different areas, things of that nature, all right? The fascinating thing, it can involve different segments. All right, so different segments of the small and large intestine, which is very interesting. All right, it may be continuous, right, which is important as well. And then usually it develops gradually over time. All right, it's not something that you're going to wake up one morning and then come to the conclusion, well, I have Crohn's disease. All right, it's a gradual progression, almost degenerative. All right? So think of it as, when it comes to Crohn's disease, inflammatory bowel disease, it's gradual. All right. Sometimes it can come on suddenly with symptoms, but usually the disease itself is a gradual progression. All right, and much of the same thing, all right, as diarrhea. These inflammatory bowel disease issues are going to include diarrhea, fatigue, again, being one of the biggest ones. All right, fever, abdominal pain, all right, blood, reduced appetite, and weight loss. And from those who I know who are going through Crohn's disease, weight loss was a big one. And diarrhea and fatigue. So don't sleep on that, guys. If you feel that you have issues with your digestion, with your bowel movements and things of that nature, you're your own best advocate. Really step up, go to bat for yourself, all right, and make sure that you go through the test and speak with your medical practitioner, because sometimes it can be brushed off as something different. Mary, good morning to you. Good morning, Coach Nate. Yes, can hear you. Perfect. Thank you so much, Mary, and thank you for joining. Always a pleasure having you in stream. So thank you so much. Again, really appreciate it. So let's go to some of the studies that have been on there. All right. Again, there can be complications, but let's go. Again, I really want to focus on the nutrient deficiencies associated with it. So we know what inflammatory bowel disease are. We know what the different types of sort of the umbrella, so colitis, Crohn's disease, all right, things of that nature all fall into inflammatory bowel disease type issues. Let's talk a little bit about the actual nutrients. All right, what are the nutrient deficiencies? And again, say hi in chat if you are so inclined to do so. I always love hearing you. Thank you so much for thumbing up the live. I really appreciate that. I see we're up to 10 likes already. So thank you so much, guys. I really appreciate that. But let's get right into some of the what some of the studies say about nutrient deficiencies causing irritable bowel syndrome. All right, so I just want to make sure that I pull up the right one here first. I have them spread out, but some of them. All right, let me find it here. So you may see it kind of cut off. All right, here we go. So here's our first one. This was a very good study. Now, it seems like an older study, but this was one of the best studies that came out back in 2009, so almost 15 years ago. But we see a lot of the studies that have come after, all right, that have sort of mimicked this sort of study, and we see the same things being when it comes to nutrient deficiency and what nutrients are important for inflammatory bowel disease. And the name of the study is, of course, The Importance of Nutrition, Inflammatory Bowel Disease. Very good journal, World Journal. Here, I really like this one. So again, we're not going to read through it. Let's just kind of sum it up here. All right, so what does this say? All right, what does this study say here? What are going to be some of the nutrients that are going to be a little bit low, some of the nutrients that are associated with inflammatory bowel disease? What are some of the deficiencies that are going to be connected to inflammatory bowel disease? Now, what this one was, it was kind of ahead of its game. This one talked about the importance of nutrition when it came there. What we see from this study, right, and the important things we can see that it's quite long, a ton of, I think it had 113 citations. So it's taking all of these different studies and kind of bringing them into one really well done study here. What we're seeing is that inflammatory bowel disease is associated with frequent nutritional deficiencies. All right, so that's the whole name of the game here. That's why we're discussing it today. The pattern and severity of which depends on the extent, duration, and activity of the inflammation, all right, and also of the deficiencies, all right. So we see here, just on the page here, I'll just highlight it, all right. So we're kind of going into it right here, so I kind of just went down. We see iron, zinc, selenium, all right. You're going to see that keep those in mind, all right. Antioxidants as well. Keep those in mind, guys. Kind of don't want to give it away. Maybe we can go down because I don't want to give them away. But we see what some of them are. We see the importance of nutrients, of vitamins and minerals that are associated with inflammatory bowel disease, and that can help us sort of deal with inflammatory disease a little bit better. We know that nutritional support allows these deficiencies in calories, macro and micronutrients to be rectified. All right? So nutrition can be, what this study found was that nutrition can be a primary therapy for inflammatory bowel disease, especially Crohn's disease, which is really, really interesting. So your nutrition plays a very, very important part, making sure that you're getting these important nutrients. Okay, so very interesting there. It can help, one, to control inflammatory bowel disease or inflammatory activity in the digestive tract, but it can also help keep it in remission or prevent or delay possibility of worsening symptoms or even the possibility of surgery. So we know our nutrition is very, very important, and that's basically what this study is summing up here for us. Excuse me as I take a sip of my morning coffee. And again, let's see some people in chat. Let's see some people asking some questions. Let's see how you guys are doing today. Thank you again for the thumbs up. I really, really appreciate it. We're going through these studies. I went through these studies. It took me quite a bit of time to go through these studies, so I'd love to get your response to some of this information. Now, we also know one of the things, if you're dealing with inflammatory bowel disease, let's say that you were diagnosed with this disease. We know that high consumption of sugar and refined carbohydrates can put you at a risk factor, all right, for both Crohn's disease and also things like colitis, so inflammatory bowel disease in general. So high sugar, high refined carbohydrates can put you at risk, all right. We know that citrus fruits and vegetables can lower the risk of both diseases, which is great, all right. So again, breakthrough study here, all right. Again, it might seem logical, it might seem kind of simple, all right. Well, yes, lower your sugar intake, lower refined carbohydrates, all right, increase citrus fruits being a big one here. I think a lot of people sometimes sleep on citrus fruits, all right, and vegetables, all right. But at the time, people were thinking, increase fiber, go with high fiber foods, right? We're kind of going away from that just a little bit here, and making sure that we're focusing on some citrus fruits, vegetables, things of that nature. We'll get into that in a second. Why? Well, calcium, you just want to make sure when it comes to things like iron and things like that. But we'll get into that in a second. All right. Fast food, if you're dealing with inflammatory bowel disease, we want fast food. All right. We know we want it to be decreased, of course. It can be linked to an increased risk in development of inflammatory bowel disease. All right, the other important thing, and the thing that I talk about all the time when it comes to omega-3s and omega-6s, why does Coach Nate always push for omega-3s? Well, we know that large amounts of mono and polyunsaturated fats, all right, so those omega-6s, all right, are both associated with a higher risk of inflammatory bowel disease. And why do I always say that we want to make sure we have a good ratio of omega-3s with omega-6s is because if we have a ratio that is just far off, right, not that ratio that we're looking for, if you're way high in omega-6s, you're creating inflammation throughout the body, including your digestive tract. So we want to make sure that we are hitting on inflammatory, anti-inflammatory omega-3s, all right? Omega-3s are the name of the game, and you'll see that in the nutrient deficiencies when it comes to bowel disease. Another study here, which I don't think I'll be able to pull up for you, but I think just is an important piece of information. Again, a study showed nutritional deficiency in irritable bowel disease individuals, so people who have been diagnosed with this disease, right? Between 20 and 85% of inflammatory bowel disease sufferers have nutritional deficiencies. This can come from a number of reasons: gastrointestinal issues, right? Restrictive diets, the disease itself, diarrhea, right? All complications associated with the disease itself. So very, very interesting. So we know, all right, and what this study told us is just the importance of nutrition when it comes to inflammatory bowel disease. So if you're one of those individuals that has inflammatory bowel disease or thinks they might have inflammatory bowel disease, speak with your medical practitioner. All right, go and do some research, all right, on different vitamins, minerals, micronutrients, things that we're going to talk to about today. I'll talk to you about today. All right, so let's go to our next one here. What are some of the micro deficiencies, so micronutrient deficiencies associated with inflammatory bowel disease? Well, the first one, I'll pull up this interesting study here, and we see this. Let's pull this one up. I really like this one. So we can just drag this over here. So I believe this one, yes, 2020. So this is a much more recent study from 2020, and we see nutrition in inflammatory bowel disease. And again, consisting mainly of Crohn's disease and ulcerative colitis. So two things that I've been talking a little bit about. So colitis, Crohn's disease, all right, again, under the umbrella of inflammatory bowel disease, IBD. Crohn's disease being the main one. All right, you also have ulcerative colitis. All right, and again, those are going up and up. So what are some of the deficiencies here? All right, what are some of the micro deficiencies that we're starting to see? So let's go over that. I thought I had another study here, but that's okay. One other study that I think might be important here. Can I bring it up? Don't know if I can bring it up here. Here we go. All right, so again, another recent study. I'll move this one after. But if you're interested in the topic, a 2021 study, micronutrient deficiency, inflammatory bowel disease, cause and effect. All right, so again, Crohn's disease, ulcerative colitis, affects 3 million individuals, and that goes up and up. All right, you always see affects 3 million individuals. All right, but that's diagnosed. All right, how many individuals aren't diagnosed with inflammatory bowel disease? Again, I've had family members, I've had friends who have gone years, I've had family members who have gone more than a decade, who had inflammatory bowel disease. I don't think they'll mind me speaking on this. Who had inflammatory bowel disease. They had Crohn's disease, and it took more than a decade. They're brushed off, more than a decade with symptoms, with pain, with digestive issues, with constant diarrhea, with weight loss, and more than a decade. All right, more than a decade to find what the cause of that was. Again, shrugged off, treated as something else. Be your own advocate. They were strong. They were their own advocate. But again, that's people who are diagnosed, the 3 million. Imagine all of the individuals who aren't diagnosed with it. And that's just in my own family. All right, imagine all those other ones in multiple families, your viewers, all right, the viewers here, your family members. All right, again, that's just one simple example of someone who's in my family, but missed it for over a decade, and complications can arise from that. That is just too long. Fortunately, they're getting treatment now, and fortunately, they're moving in the right direction. Gloria, thank you so much for coming in. Good morning to you. Sunshine. Finally, we got some sunshine here too, Gloria, so it's very, very nice. Good morning to you. I appreciate you coming in here, Gloria. I appreciate you typing in chat. Seems like we have some viewers here who are being a little bit shy this morning, but that's okay. Of course, again, sometimes I can ramble on, and people are happy with that. Sometimes we really have a lot of engagement. This might be one of the me rambling just a little bit, but going over the studies, me trying to summarize them, I think that's best. So let's talk about the actual nutrient deficiencies. And again, Gloria, thank you so much for joining, and thank you everyone who is in chat and giving a thumbs up to the stream. Again, we're at 12 likes. Thank you so much, guys. You guys are the algorithm of the channel. YouTube is fickle in that way, so I really appreciate it. So what do we see? What comes up time and time again? All right, we've brought up, there's one other one, if I can find it here. All right, so this is the one I want here, but there's other ones here. All right, role and diet of nutrition in inflammatory bowel disease. All right, 2021. That's another great one. And again, you see the same things. There's a theme that's going on and on. What is the nutrition? What are people lacking? All right, if they have inflammatory bowel disease, all right, or their digestion, all right, is suffering. A lot of times we're associating it today with inflammatory bowel disease. What are those deficiencies? Well, let's go over them right now. All right, the relevant nutritional deficiencies, that we see in Crohn's disease and overall inflammatory bowel disease, time and time again. All right, I'm underlining as I go over all these studies. You're seeing things like iron, you're seeing zinc, and you're seeing selenium. All right, those are the relevant nutritional deficiencies. So again, iron, zinc, and selenium. Iron, of course, important for that creation of red blood cells. A lot of people with Crohn's disease are low in iron. All right, so it's not uncommon, all right, if you are dealing with inflammatory bowel disease, all right, to be low in iron. And so that's something you're going to want to speak with your medical practitioner about. So low in iron, all right, especially in Crohn's disease, we know that. Another thing, oxidative stress, inflammation, super high. All right, obviously, it's in the disease. All right, inflammatory bowel disease. All right, so oxidative stress is very prevalent. All right, in individuals who are dealing with this disease. All right, so another thing, all right, which perpetuates the inflammatory response in people who have inflammatory bowel disease. All right, they have insufficient intake of antioxidant agents. And what are those? All right, some of those, right, are going to be vitamin A, vitamin C, vitamin E, and again, going back to selenium. All right, these, if you have inflammatory bowel disease, are extremely important, and we see that in the data, and we see that in all of these journals. All right, from 2020, from 2021 here. All right, it was highlighted nicely there for me. All right, again, time and time again, you're seeing that. Right? We also know, so let's go over it again. And again, you're going to see this from every study. All right, every study, there's going to be a pattern here. Iron, zinc, and selenium. Also, lower in antioxidant agents. Sorry, I had an ad pop up. Lower in antioxidant agents such as vitamin A, C, E, and selenium. Now, I take an ACEs supplement, so it has ACE, and selenium in it. That's why it's called ACEs. All right, that's my antioxidant supplement. Again, that's not because I have inflammatory bowel disease, but we want to make sure that we're getting those antioxidants in place for our overall health and for our digestion and inflammation throughout the entire body. a very, very important thing here, guys, that I want you to take away. What did these studies show? All right, what do these studies show here? All right, well, the main thing is nutritional therapy. All right, and this is from the 2020 and 2021. All right, nutritional therapy should play a role, all right, or should be considered to play a role, all right, and even a fundamental role in the clinical management of all patients with inflammatory bowel disease. So a lot of the times you'll go to the doctor, and of course this is fine, but they're going to put you on a number of treatments, which again can be very, very helpful. I've seen it firsthand. I've seen it in studies. I've seen it with clients. I've seen it with family members, which can be very, very helpful. But again, you got to do your part as well. It's working in combination, right, with these individuals. All right, working in combination with these individuals. Do yourself a favor. Nutritional therapy should play a fundamental role in the clinical management of all patients with inflammatory bowel disease. Now, what are some of the other, nutrient deficiencies? Micronutrient deficiencies. So we're not talking macro, we're not talking carbohydrates, protein, fats, things of that nature. All right, we've already gone over some of them. All right, they're going to be iron, zinc, and selenium. We're also going to see antioxidants being low. Vitamin A, C, and E. We also have selenium, but it's already been mentioned. Here's the other big ones, guys. Iron, we already know, but folic acid. Folic acid is huge. It comes up in almost every study. And also vitamin B, again, comes up in almost every study. All right, this one right here, huge on folic acid, vitamin B12, and iron. The other important thing, and now it seems like you might be inundated, all right, with a bunch of nutrients that are going to be low. But this is showing how important nutrition is for those individuals with inflammatory bowel disease, all right? Because what we can say is low, all right? And there was another one here. I didn't bring it up, all right? It was called Nutrition and Adult Inflammatory Bowel Disease. They had calcium. They had vitamin D, folate, though, vitamin B12, and zinc. So that's another study. I didn't bring it up here. That's from 2003. It was a little bit older. I wanted to bring these newer studies up. But we even see in those later studies that were done 20 years ago, they already saw that vitamin D, folate, vitamin B12, and zinc were low. And we see these in the 1920 and the 1921 papers. So how amazing is that? So we know the deficiencies, guys. We know what the deficiencies are, right? Also vital to consider here, all right, and what we see in not only this, so nutrition, inflammatory bowel disease, not only in this one, not only in this study here, role of diet and nutrition in inflammatory bowel disease, all right, but we also see the importance to consider probiotic treatment for irritable bowel disease. Okay, the importance of course, gut health. If you're dealing with inflammatory bowel disease, you're going to want to make sure that you're focusing on overall healthy, good microbiome and good, healthy bacteria in the gut, throughout the small intestine, throughout the large intestine, and throughout the whole digestive tract, to be honest. The gut, everything. So let's break it down just a little bit. Let's kind of simplify everything that we've been mentioning in all of these studies, okay? The nutrient deficiencies, we've been going over all of them, all right? So we see, all right, the big ones here, all right? The big ones here are going to be omega-3s as well, all right? And that's why, again, we talked about the ratio of omega-3s to omega-6s. It is often very, very high in omega-6s. All right, our diets are usually very high in omega-6s, which creates inflammation. If you have inflammatory bowel disease, you obviously, of course, want to decrease that inflammation. So make sure, all right, if your nutritional therapy, all right, of course, which we know and we see in the studies, should play a fundamental role in managing inflammatory bowel disease for all patients. Again, speak with your medical practitioner about that, but we got to do our own part. Omega-3 supplementation, or just eating foods that are high in omega-3s, are very, very important. So I kind of created a list here, right? What do we see as being, the ones that are always shown, all right, the nutrient deficiencies associated with inflammatory bowel disease, and the nutrients that can help improve, all right, act as therapy for those individuals with inflammatory bowel disease, those with Crohn's disease, those with ulcerative colitis. See, again, as I was mentioning before, inflammatory bowel disease consisting mainly of Crohn's disease and ulcerative colitis. Again, I went over a little bit of the signs and symptoms of those two diseases. So if you think that you have it, right, if you think that you have inflammatory bowel disease, make sure that you go out and get checked, because you could have Crohn's disease, you could have ulcerative colitis. Again, you want to get on that as soon as possible. But what are the ones that are coming up in basically all of the studies from 2002 up until 2021, right? And there's probably ones that, are coming out even earlier now, but we don't need them because we have more than enough, right? One, folic acid is huge, guys. Folic acid, vitamin B12, huge as well. Iron, all right? Those are the huge ones, right? If you're going to focus on any, I would focus on iron, folic acid, and vitamin B12, right? Those are the big ones. Those are going to be your go-tos in nutrient therapy, because nutrient deficiencies in those micronutrients, right, have been associated with inflammatory bowel disease, all right, especially Crohn's disease. Now, the other thing, all right, is going to be omega-3s, all right, probiotics, vitamin D12, and I have a family member and a friend who have Crohn's disease, and interesting enough, the doctor actually said that they should be on vitamin D. You don't hear that a lot. You hear of things like Stelara, things of people with Crohn's disease, being treated with Stelara. You see prednisone, a very it's a steroid, almost similar to cortisone. I forget. I'm trying to pronounce the family that it is, but prednisone, Stelara, things of those, hard medical drugs that doctors are going to prescribe. Monoclonal antibodies, I believe that's what Stelara is. I'm not a doctor. I'm not speaking about this from a doctor's standpoint, but those are the things that is often treating Crohn's disease, especially those individuals who have had it for numerous years and were not getting treatment for it. It was missed by the doctors, all right? It was missed just getting the wrong studies. But you're going to see things like that treating. All right? Now, they will put you on that, possibly. All right? And again, that's not to scare you. That's just, things you have to speak with your medical practitioner about. But the interesting thing is, all right, they talk about vitamin D as well. All right? And we know, all right, a lot of doctors don't talk about micronutrients. I haven't had a doctor talk to me about micronutrients before, not that I can remember, and I certainly would probably recall that. A lot of drugs, but not a lot of micronutrients. And micronutrients, remember, we already know from the studies, nutritional therapy, all right, research shows that nutritional therapy should play a fundamental role in clinical management of all patients with inflammatory bowel disease. All right, so they'll put you on those drugs, or possibly put you on those drugs. Again, that's why you have to speak with your medical practitioner. All right, but vitamin D came up. All right, so what are the constants? What are the nutrient deficiencies associated with IBD, inflammatory bowel disease? Folic acid, vitamin B12, iron, which is huge. Iron always comes up, of course. Probiotics, omega-3s, vitamin D, and then your antioxidant agents. All right, your antioxidant agents, it's inflammatory bowel disease, so you want to make sure you're attacking that inflammation. All right, so vitamin A, vitamin C, vitamin E, and selenium. Those are the main ones that are coming up from time to pretty much all the time. All right, folate, folic acid, folate. All right, calcium here and there. I only found that in one study. All right, so I'm not going to bring that up. But calcium, the only thing is, all right, when it comes to calcium, it can inhibit the absorption if you're, supplementing with iron or you're trying to increase your iron intake. Calcium, I believe, can help hinder the absorption of iron. So you just want to be careful if you're taking that. All right, spread it out. At least 3 hours. That's what I've heard. That's what I've read. Again, speak with your medical practitioner about that. All right. Again, I'm going to say it one more time because these are the nutrient deficiencies associated with IBD. Folic acid, vitamin B12, iron, huge one, probiotics, omega-3s, vitamin D, vitamin A, C, E, and selenium, your antioxidant agents. Okay. Now, just give me 1 second. I'll be right back. Any questions in chat, let me know. All right, we are back. Thank you for sticking with me here. Let's see, we have 13 likes. Thank you so much, guys. I really do appreciate it. I know we're in the Christmas season. I know we're in the holiday season. December 29th, unbelievable. So I appreciate you guys joining me in here, especially in the morning. Again, if you're just joining the stream, all right, what are the nutrient deficiencies associated with IBD? I've said it enough here, but in case you're just joining the chat live, that's the one thing. Folic acid, vitamin B12, iron, omega-3s, vitamin D, and then your antioxidant agents, vitamin A, C, E, and selenium. Those are the ones to always come up, guys. Gloria, thank you so much if you're still in chat. So hoping to get a little bit more engagement on the chat here, but again, that's okay. We keep going, and I appreciate having you all in here. All right, the engagement is the nice part because if you're dealing with it, I can answer specific questions, even if it's not related to IBD, all right, or nutrient deficiencies or anything of that nature. Feel free to ask a question. We're on these lives, so now's your time to do it. So what are some foods to eat? We know the nutrient deficiencies that are associated with IBD. What are some foods that are recommended, that I might recommend you should eat? I would speak with your medical practitioner. All right, but what are some foods that you might want to eat if you're dealing with inflammatory bowel disease? Well, for one, make sure you're staying away from sugar, all right, and processed carbohydrates and fast food. We see that numerous times in the studies, okay, of course, and that's common sense. We want to make sure we're staying away from those foods. They lack nutrients, and they create inflammation, which is only going to make your symptoms worse if you're dealing with Crohn's or colitis or anything like that. Now, A big one was eggs, B vitamins, iron, vitamin D, and folic acid. All right. Again, if you wrote down the nutrient deficiencies, you know how important those are. One, all right, a big one was carrots. You can cook them, all right. You can steam them, but carrots was a nice one because it gave you vitamin A, all right, which is good. All right. Another one, surprisingly, is going to be chicken. All right, protein, which is good for us. And this is in small amounts, all right? But you have B vitamins and you also have zinc, all right? So chicken, all right, you can eat it in a number of different recipes, but chicken was also good for us as well. Why? B vitamins and zinc, all right? Another great one for us, all right? And this is an important one to write down, all right? Salmon, all right? Cooked salmon, all right, I would go with salmon because one, you're getting those omega-3 fatty acids and you're decreasing that ratio, all right, where you're super high in omega-6s and super low in omega-3s, which is creating that inflammation here. All right, so salmon, high in, or you could just take a fish oil supplement. All right, a lot of them are in, what's the word? Doesn't matter, but it includes vitamin D, fortified, all right, fortified with vitamin D, all right, but get that EPA, DHA, all right, omega-3 fatty acids, salmon, or take a fish oil supplement, all right. I would just go with the salmon if you can, but the fish oil supplement's not a bad idea as well, all right. One thing, lots of water. All right, make sure that you're properly hydrated. That's a very, very important one if you're dealing with inflammatory bowel disease. All right, but another great one is green tea for its EGC gene. We see that in some studies where this can really benefit those individuals with Crohn's disease because of its potent antioxidants, and especially for that potent compound found only in green tea, I believe, all right, EGCG. And we've talked a little bit about that on a number of different streams. The other important one is probably a probiotic supplement, all right, and then citrus fruits. All right, why? Because they are high in folate and they're high in vitamin C. All right, but make sure that you're getting eggs. All right, you can supplement with iron. You can supplement with vitamin B12. I know individuals who get vitamin B12. I know individuals who take a vitamin, myself included, take a vitamin B complex. All right, supplement. So I'm getting all my B vitamins in one. So I'm making sure I'm really hitting that vitamin B12. I take a probiotic as well, and I take vitamin D, and I take ACE and selenium supplement as well. So I hope that helps. I hope we were able to break that down. I hope we answered the questions. What are the nutrition deficiencies or nutrient deficiencies that are associated with IBD? All right, consisting mainly of Crohn's disease and ulcerative colitis. I know a lot of individuals who are going through this right now. We know millions of individuals who are actually diagnosed with this. Remember, I talked about the misdiagnosis or not being diagnosed with it, who actually have it. So we want to make sure that we're really focused on this if you have this disease, all right, and even as a preventative measure. We know in the studies that nutritional therapy should play a role, all right, they found this in the study, should play a role, all right, and a fundamental role in clinical management of all patients with IBD. So I hope that helped explain just a little bit. As we move forward, there should be another stream coming up this week, probably before New Year's. We'll see. New Year's is coming on very, very fast. This one should include my face and should include the studio. So I know a lot of people are really clamoring for that. I know individuals pop in here real quick almost to see if I'm doing a stream on that. That will be happening. So if you're listening to this later on, just know that that will be happening. I would like to get, like Gloria had here, like Mary had here, I would like to get some input from you guys just in stream if possible. All right, asking questions, maybe related to the topic at hand or just related to other health questions that you have. There's numerous health questions out there. So I think the next one is going to be on, well, what's today? Friday? Maybe tomorrow, maybe Sunday, maybe both. There's going to be a pre-New Year's and a post-New Year's, so we'll make sure we talk a little bit about that as we get in a little bit closer into 2024 and talk about our goals. A lot of content coming up, all right, and we're going to get back to the videos, and I figured out how to make shorts. We did a little bit of a test. I know it didn't turn out exactly as planned with the last YouTube short. I know I had to put it up as a video, but better to put it up than not put it up. So it got put up as a video, not as a short. But that has now been conquered. We have the shorts that are going to be being made. Quick information on a number of different topics. So make sure you're looking out for that as well. So here are the main things to look out for the Foods for Health channel. All right. Our videos, which you guys know are being posted on a regular basis. There's thousands of them. Live streams, which are going to be continuing into the new year. Even before the new year, we're going to have another live stream, so look out for that. You should get the notification. And YouTube Shorts, quick information on a number of different topics, a number of different foods, and the health benefits of those foods. And continue with the breakdown here, except the only thing that's going to be different is we're going to have my face in this corner down here. All right, and I will obviously be going full screen as well, but my face will be in there and you'll be able to see the studio as well. I got another thing for the studio, which is very nice. So it's really coming together. The studio, very, very happy with it. I want to show it off. The only reason why I didn't get on stream today, I was trying to play around a little bit my face on stream and the studio. I was playing around a little bit with the dimensions of recording a video. So that was off just a little bit. I didn't want to go in there, take up too much time going through all the settings that I had to try to change to try to get that YouTube short up. So I thought it'd just be easier to get on here as is. It's better to get on here than not get on here. That's what I always say, and get the information out here. So again, appreciate you, Mary, Gloria. Big shout out to you two for coming in here, leaving a chat. Gloria, I appreciate you. Mary, I appreciate you, and appreciate everyone else that came in here and listened to the stream as well. Hopefully, let me know how you enjoyed the breakdown. Was it, give me some feedback. Give me some feedback in the comments below. Did you like the breakdown of the actual studies, of the journal articles? Did you like the discussion of how we went from, talking about the different symptoms, talking into the different journal articles, into the nutrient deficiencies, and then to some foods that you might want to think about. So let me know what you think about that in the comments below. And again, we're going to be doing a lot of streams moving forward, maybe even twice a day. I want to go over some of the things that I'm seeing out there, some of the guidelines that are now being made moving forward when it has to do with health guidelines. So I want to make sure that I comment on that. And again, I just want to make sure that I'm focusing on the content that you guys want. So let me know in the comments below what you want. Let me know real quick here in the comment section. Gloria has posted a comment. Mary has posted a comment. Let me know what you want to see. Don't be shy. I'm always open to suggestions. The 2 suggestions that I've gotten so far are going to be videos that I'm going to be making very, very soon. So next we have the game plan is omega-3s. The game plan is talking about the carnivore diet or just diets in general. All right, and what was the other one? Well, we'll have to do a New Year's stream. Can't remember it off the top of my head, but that's okay. All right, we'll do the New Year's stream. I think the New Year's stream is the other one that I'm thinking about, but we'll make sure we do the New Year's stream. So thank you so much for listening, guys. We went 48 minutes. I appreciate that. Look for those notifications because these streams are going to be coming a lot more consistently. All right, we'll have the face on, we'll have the studio up, and we'll get into a lot more discussion when it comes to health, wellness, and everything in between. So thank you so much. Big shout out, Gloria. Big shout out, Mary. Thank you so much. This is the Coach Nate Show on Friday, December 29th. Thank you so much for listening. Appreciate it, and I will see you next time.